tympanic canaliculus, you will find here, actually there's a small thinned out crest between, you're seeing from the inferior view, right? So you're finding is the carotid canal, and this is the jugular fossa. So in between the jugular fossa and the carotid canal, there is a thin plate of bone, and onto that thin plate of bone, you will find there is this canal, and that's called tympanic canaliculus. Through this tympanic canaliculus, it is the tympanic branch of glossopharyngeal nerve. So it's the first branch of glossopharyngeal, right? And that arises from the inferior ganglion of the glossopharyngeal nerve. So tympanic branch of glossopharyngeal essence, and it passes through the tympanic canaliculus, and from here it will reach into the middle ear cavity. And within the middle ear cavity, it will form a plexus over the promontory, and that's called tympanic plexus. And in this middle ear cavity, there's all mucosa lining the middle ear cavity, and that will be communicating anteriorly to the auditory tube, and posteriorly it will be communicating to the adductus with the mastoid antrum, and the ear cells. So all of this surface of the middle ear will be innervated by this nerve, tympanic branch of glossopharyngeal nerve. And don't forget that this nerve is also carrying preganglionic parasympathetic fibers, which will have nothing to do here, rather they will extend as lesser petrosal nerve, and they'll emerge out of this petrous temporal bone in the form of hiatus for the lesser petrosal nerve on the anterior surface, and will pass out through foramen ovale. And remember that this nerve also has a different name, that the tympanic branch of glossopharyngeal nerve is called Jacobson's nerve. So these are some named nerves, you need to remember them. Jacobson's nerve is the tympanic branch of glossopharyngeal nerve. Alderman's nerve or Arnold's nerve is the auricular branch of vagus. Both of them, they are entering to their destinations from this jugular foramen.